This is a Founding Media podcast.
Hey guys, welcome to Apple a Day Doc Talk. I'm your host, Dr. Ramdeen, and I have a really cool guest today. His name is Dr. Samuel Sneed. Hey Sam, how are you doing today?
Doing well.
Thanks
Thank
for
you.
coming. So Dr. Samuel Sneed is a native Texan and studied biology while attending the University of Texas at Austin. He then continued his education at Parker College of Chiropractic. In addition to earning his Doctorate of Chiropractic in 2008, he also received a Bachelor of Science in both human anatomy and health and wellness. And he specializes in the evaluation and treatment of athletes in regards to both pain and injury prevention. And his extensive experience, including taking care of professionals, is really impressive with the NFL, NHL, MLB, and PGA Tour. So really, really valuable resource. We're really lucky to have him today. And Dr. Sneed is the owner of Next Level Chiropractic and Rehab in Austin, Texas, where we are right now. Next Level is a different kind of clinic. They offer a multidisciplinary approach, including chiropractic care, physical therapy, small group personal training, and massage therapy. Their purpose is to help you achieve your goals, and some seek his help for pain relief. Others want him to help them out with mobility or performance, and maybe both. They specialize in movement-based evaluation and treatment systems to help you reach your goals in the most timely, cost-effective way possible. I've been to the facility. It's amazing. It's a very nice mix of, that common pain, that patient with pain coming to help out with suggestions, all the way up to the professional athlete with basically a mini gym in there.
Yeah,
so you
yeah.
can watch how they're performing.
Yeah, we can do everything from hot disc, low back injury to my knee only hurts when I'm squatting 350. So we got a full rack in there, and we have a very broad spectrum from 8-year-olds to 85-year-olds that come in on a regular basis. So
it's really impressive. I hope anyone in Austin that's looking for a chiropractor checks it out. It's a really impressive facility. And the reason Dr. Sneed is here today is because we're going to talk about dry needling and cupping. Mm-hmm. This is very popular right now, and wanted to have someone who's very well versed at it come and talk. So
Sure.
Thanks a lot, Sam. And why do people do this? Why is it applicable? And are there any specific conditions that patients have that would benefit from this?
Yeah. Well, the two therapies are very different, obviously. Yeah. Let's start with one that I don't use as often, but can hit home runs, mm-hmm. and I like it for certain reasons. Is cupping that you've seen with. I know a lot of patients started asking about when Michael Phelps had the big suction marks on his shoulders when he's winning all the gold medals, and it's something that I found. When it is useful, I really like it because I can set somebody up. I can teach them how to do it within a few minutes.
Oh, wow.
And they can order a set on Amazon for usually less than $20.
Wow.
And then it gives them some good self-efficacy, right? So if I'm trying to eliminate all the times that you would need to come in to see me. I'm always going to be busy if I'm doing a good job, so I don't need my patients coming in when they can take care of it at home.
I love that. Yep.
So conditions for cupping would be really anything superficially based. Mm-hmm. So maybe neuropathic pain or pain that's coming from irritation of nerves, whether it be compression or some stagnation, maybe some poor venous flow around a nerve that can sensitize it. The cups can be very useful. As a chiropractor, of course, a lot of thing that we see is low back injuries, right?
Right.
Discogenic pain, we've shared a client with that.
Yes.
Kind of the proposed mechanism of the result of a disc injury is oftentimes losing segmental stability, right? So you do something typically flexion under load, we'd say. Like people come in all the time, they're like, I felt something pop when I was deadlifting today, right? And then they come in and they're very flexion intolerant. They've pain that's worse in the morning, right? Mm-hmm. They might have some sciatica, pain that's going down their leg. We put them through a battery of exams, orthopedic exams. We're checking reflexes and dermatomes and myotomes, and we get to the point where we're ready to make the diagnosis, right? You look like you have a disc injury.
Right.
We know that discs typically, do not like to flex, right? We're avoiding any flexion of the low back. And one very popular therapy is what are called McKenzie extensions, right? Where you'd be laying on your stomach and doing prone press-ups.
Okay.
So repeated extension of the lumbar spine can, in people that it helps, it can really help. It doesn't help everybody, obviously, but what happens is a lot of people, when they lose segmental stability, those erectors in the low back will tighten down. And when they tighten down, they can grab that cluneal nerve as it exits out of T12 and goes down the lumbar spine and that kind of like upper hip bones, like iliac crest area, right? So then you put somebody in some prone press-ups and they can't do it. They're like, oh, that hurts.
Yep.
But you can do some cupping on their low back because that nerve is very superficial, desensitizes them, and now they can do prone press-ups. And so now they can bang out a set of prone press-ups. They stand back up and like, oh, that's so much better.
And this speaks to me on a personal level too, Sam, because I had a couple herniated discs a few years ago, and it are those extension type exercises that save you.
Yeah.
Right? And so you're going to be taking care of me soon because I have a few things like that, and pronation distortion, flat arches, things like that. And so that's what I love about you is you really you're not just treating the one thing. It seems like a very functional place to be.
Yeah, that's the aim. Yeah. The aim is to get people back to training, right? We don't want you to get great at rehab. We don't want you to have to do prone press-ups your whole life. We don't want you to feel like your back goes out,
right?
And then we have to put it back in, whatever that means, right? So if we're doing a good job, we're making ourselves obsolete and educating you. So low back. There's a couple nerve entrapments in the upper extremity. People that get it used to be called cubital tunnel, like that ulnar nerve, your funny bone.
Right.
Now I've heard it called like I think there's like sleeper's elbow because some people sleep like that with their elbow bent really acutely, right? So that kind of ulnar nerve compression. Some people call it texture elbow now. But man, some cupping or cupping with movement right in that medial intermuscular septum, kind of inside of your arm. That can be really beneficial, easy to do at home. We do a ton of it up here at Erb's Point, which is like that posterior SCM, the side of your neck, right?
Yep.
That's a kind of the superficial branches of your cervical plexus. There's 4 nerves that come out of there. And there's a lot of people that have had chiropractic adjustments, physical therapy, massage, you name it. And you can sometimes get laughably good results just by doing a little bit of skin tugging in here with some kind of provocative movements to desensitize.
Right at the sternocleidomastoid, right?
Right there,
under
the jawline, right. And I actually had a new patient today with it, of course.
Really?
So we'll do some other therapies there. I did some needling, right, to detone the SCM, but he actually had a pretty significant surgery. They removed 52 lymph nodes because of cancer. And then he had some cancer on his tonsils that they found a couple weeks later. So he's had a lot going on and a lot of therapy, but I think we made some serious headwind today.
So basically you're just trying to decrease the tonicity of tight muscles.
Let's say, I'd say more, that'd be more needling probably versus, cupping, acting to lift the skin or create some decompression maybe for nerves. That's typically how I'd use that, more superficial areas, and
got it.
Maybe neuropathic pain that's not traditionally, like people would describe it, not necessarily radicular. I have a L5 disc herniation neuropathic pain, but more like a superficial cutaneous nerve.
Right. And so the reasons for dry needling in general, why do we do that? Why do we do that?
Dry needling, I do a lot of other therapies that we're not going to talk about today, but dry needling is by far, in my opinion, biggest bang for your buck, home run hitter,
really
objective movement changer. There's a lot of applications for it. Rapid decreases in muscle tone, right, with objective change. So somebody comes in, they try to lift their arm up, and they can get to 140 degrees, and they have a pinch.
Yep.
Right, and they'll tell you they've had that for weeks or sometimes months, right? And you can needle, and sometimes in as little as 30 seconds, recheck, and they might have full flexion of their shoulder with no pinch. that mechanism of when you hit a trigger point, kind of it's like hitting a breaker switch in the muscle, right? So it resets the tone, and it can be, it's so effective that oftentimes it's diagnostic, right? So if I think something is going on, if I think your hip isn't internally rotating because of your TFL or your adductor or maybe your rec fem, I can needle it and then just recheck it.
Wow.
And if I see a change, that would imply that that'd be a good spot for us to load you up on some homework so you don't have to come get needled all the time. But it can be so effective if it doesn't change. I'm thinking, well, this probably doesn't need a whole lot more work versus a lot of other therapies that you need repeated bouts to see if this thing is going to work, right? Like a lot of things make people feel better,
right,
without seeing nice change.
So what you're doing is not just helping them with symptom relief. This is a key diagnostic tool for the way you approach these issues.
Yeah, for sure. I mean, symptom relief is ultimately why people come.
Right.
But if my job was just chasing symptoms around, I joke all the time that you'd be using me like a big expensive bottle of Advil, right? We need to get to the cause of the problem, right? So I would say on a typical client, I might do 10 or 15% of what they want me to do, and then I sneak in the other, 85, 90% of what I know I need to do. Otherwise, they'll just be back for the same.
It seems really like your goal, which is why I like what you're doing, Sam, is you're trying to empower your patients with the conceptual knowledge that they need to be able to do things at home for cheap. You're not looking to have them come back for step 2, then come back for step 3.
Yeah, we want to squelch the pain for sure. That's why they're there most of the time. And then, I think if you have my job, you want to see people get better. And if you teach everyone how to best take care of themselves, they're going to trust you. They send more people to you. They like you better. They're more likely to come back the next time something else hurts. And there's, of course, going to be people that are tough that do require lots of care anyway. So it's good to hit the home runs when you can, and then sometimes you got to dig in and
That's what I love
go to
about
work.
you and is my philosophy as well, is just arm the patient with the conceptual knowledge so that they can plug in, whatever they need to do within their lifestyle. They don't have to come in and fit their square life into your round peg hole.
Right.
So, and then one thing I wanted to talk to you about was the dry needling. When patients hear that, or people in general, their mind goes straight to acupuncture.
Yeah.
What's the difference?
Oh, sometimes the difference is best explained with the similarity, which is you use an acupuncture needle, and that's about it, right? So I've gone through some basic acupuncture certifications here in Texas as a chiropractor, so that I can then go get trained in dry needling.
I see.
I don't want to get my head chewed off by an acupuncturist, but essentially. And I still refer to acupuncture.
Sure,
it's just,
yeah.
I'm not trying to manipulate any chi, right? If you're coming to me to get your chi balanced,
I have to take my chi somewhere else.
You're in trouble, big trouble, right? I mean,
so that's basically what is that realignment of the chi? That's the whole goal of acupuncture.
Essentially, right? Your chi is kind of more or less your life force energy. The chi is believed to travel in meridians, highways. That's the kind of the highway system for the chi. So, and it goes way deeper. There's experts that talk about the stagnation of chi and all these. It goes very deep in this, but for the most part, right. I'm doing more of like a Western exam, typically a movement-based exam, orthopedic exam. So whereas in a traditional Chinese medicine, the needle placement is not only to manipulate your chi or balance your chi, but the diagnostic might be feeling your pulse.
Got it.
Or looking at your tongue. Or some practitioners hearing your symptoms, right? Versus mine would be checking your shoulder internal rotation, taking you through a series of a battery of tests, looking at your thoracic extension, et cetera, to
So basically, you're using the dry needling as an extension of your core foundational chiropractic approach.
Right. Like
it just helps augment what you're already doing.
Have you used a hammer before?
Yes.
Yeah.
I have.
Are you a contractor?
I am not
No.
a
So
contractor.
it's like, I use a needle, but I'm not an acupuncturist, right? So it's just it's one of many tools. It just happens to be a very powerful tool,
Right.
in the way that we way that we use it.
Really helpful. And yes, we had another mutual patient that does it and swears by it. You know, these are really intense athletes, like Ironman competitors. And so, again, if you're thinking about doing this, just check out Sam's website. I wanted to ask too, this is a common question I get. Well, I heard about dry needling, but does it hurt? Or the cupping, does that hurt? Do you?
Yeah, you know what? Some people do say the cupping hurts.
Okay.
I think that I'll give them the benefit of them having just being very sensitive because of their pain
Yep.
at that moment. Or everyone has a different pain threshold and tolerance, but
Right.
I would have to say cupping does not hurt.
Okay.
It can, if you're doing some cupping with some movement, you don't have enough lotion down, you're dragging that cup around, you have the opportunity to make some discomfort happen. Mm-hmm. But compared to a lot of other popular effective manual techniques, I would say cupping should be pretty comfortable.
Pretty painless.
Yeah, it of course depends how long you leave the cup on,
Yep.
How much movement you're doing with it, or if you're doing movement.
How long are you supposed to leave the cup on? Does it matter? Does it depend on the condition that you're
100%,
in, the location?
yeah, for sure. I mean, depending on somebody's tissue health, right? Mm-hmm. So I have not seen the research on this yet, but I understand that there's supposed to be some coming out that talks about how cupping challenges the microcirculatory system locally. So that cup gets on there, it creates a vacuum, blood rushes into that spot.
Oh, wow.
When you remove the cup, the blood should be able to come out.
Okay.
If it does not, you get a big fat bruise, right?
Right.
So the idea being, and I have noticed this anecdotally in my practice, is if let's say you leave a cup on, you stick it on there and you do 7 pumps, right?
Okay. Yeah.
So there's kind of like a standard amount of vacuum on there, and then you leave it for 5 minutes, and that patient might turn purple, right? And I have an assistant that's watching so that we can avoid purple back syndrome, right? But let's say they turn really red or even purple in some instances. You could continue with weekly treatment, and maybe by their 8th, 6th to 10th treatment, they don't turn purple. Or the bruise that used to last 3 or 4 days, it now turns into like a red spot that's gone in a couple hours.
So it depends a lot upon the skin, their vascularity, maybe even their protein status. If they have hypoproteinemia and they're prone to extravasating fluids out into the extracellular space.
You're just using big words now.
So,
why is he doing this?
You probably don't want to leave it on super long with 50 pumps.
Oh, right. Yeah, it's the first couple of times you're seeing somebody, you're just doing it's an educated guess, right?
Yeah.
Their general health and well-being, hydration status. Some people are clearly just ill. You run into it all the time, right?
Yeah.
So on a young, robust 20-year-old male who's got a more acute flare-up for the first time, it's going to be different than treating somebody who's 60 and has had 3 failed back surgeries and is 40 pounds overweight, right? You're going to make a clinical decision based on. So
basically, the answer is it depends.
In my world, that's my
It's very nuanced. Yes. All right, and then so the needling. Does that hurt? Yeah.
I always joke with my new patients. They'll be like, "Oh, is this going to hurt?" I'm like, "Oh, without a doubt. Without a doubt. This is going to be
really
horrible."
badly.
It's not always. It, again, depends, right? So depending on, really, if they have a lot of neuropathic pain, let's say somebody has some hot sciatica, pain is flowing down their leg, and you think they maybe have a little peripheral involvement, right? Maybe that sciatic nerve is compressed a little bit in their glute. Treating that side is without a doubt going to be more uncomfortable than somebody that just has like a little loss of hip flexion.
Oh, okay.
So the condition can drive it, and of course, again, some people are innately. I'm not tough by any stretch. I do well with getting needled. It didn't bother me. I was all excited when I learned it because I got I got treated at the seminar, and I'm like, oh man, this is killer, and it's not uncomfortable. And then I came back and started doing it, and people were like, oh my God.
Yeah, and it seems like it's got so many just diagnostic advantages for you too.
Yeah, it's like a cheat code.
Yeah.
It works real good. So I will say in some people, yeah, a lot of clients be like, man, that's weird, right? Because when you hit a trigger point inside of a muscle, a little tight, hyper contracted area, the muscle will twitch. They call it a local twitch response.
Okay.
And when that happens, it's an involuntary muscle contraction. So it's super weird. Some people are like, oh, that's really weird. Other people act like I treated my sister, came over with some knee pain last night. She pulled the brother card, came over.
Nice.
I'm treating her knee, and she sounded like I was pulling her fingernails out. Whether that's family, whatever. She's usually pretty tough, but it greatly depends. And there's more comfortable ways to do it, right? You can. We have little handheld muscle stim units where we can go and find the trigger point, leave it in, and then hook it up to kind of literally a handheld unit where we'll put one needle, leave the needle in, and maybe have somebody hold a grounding pole and then run a little bit of electricity through it. So it's like a rhythmic kind of twitch.
Okay.
That a lot of people find to be more comfortable. So on the whole, my default is, of course, it hurts. It's weird. It's foreign. But most people within usually 3-ish visits find it to be much more comfortable. They're already seeing good results. They don't get as sore afterwards.
So you kind of ask them to hang in there for a couple of these sessions.
And then by then they're like, oh, can you just needle this spot and this spot and this spot? And I think if you just did this one.
That's where you listen to the 15% of what they're asking, right? So, yeah, sure, I'll do 15% of that.
Exactly. So I guess it depends, but I think the default is, I think usually it'd be fair to say that dry needling can be uncomfortable.
Okay.
But worth it.
And I was going to ask this next, how long you expect to see results? You said about 3 sessions for the dry needling, or?
Man, it can be, the 3-session thing is probably more in relation to
just pain.
And recovery, and when they start to be like, oh, this isn't so bad. I would say results can be immediate.
Okay.
Right? I'm definitely looking for immediate objective change each visit. So objective just being, did I table test somebody? I check their back hurts. I think it's because of a lack of hip extension. I check their hip extension. I treat something. I recheck it. Did it get better? That's what I'm talking about objective, right? I'd like to see that change intra visit.
Wow. Okay.
If I don't, then maybe I'm on the wrong spot, or maybe it'll take a few, right?
Yeah.
But it's very rare that we don't see some nice objective. And then, of course, subjectively, a lot of people will get relief also in the visit. Sometimes in the beginning replaced by some soreness, right?
So if you're looking to try this, you'll know by the end of that first visit if this is for me.
Yeah, I would say buckle up for your practitioner. Give them a few shots, right? Because, of course, if you're going for the true cause of somebody's pain, and let's say they do have, their IT band's bothering them, or their knee, their quad, and then your practitioner's needling your quad, right? But in a lot of those cases, you'll find hip weakness or ankle immobility, and that's what's driving the bus of the knee pain, right? And that's not going to go away in one visit. Somebody has a weak hip, they're not leaving with a strong hip.
Right.
So if you're getting just pure symptomatic relief short term, it could happen in that visit. Anybody that's suffering from any real disorder, pain, underlying cause, I mean, it's probably it's fair to say it could take a couple weeks to start to make a dent in some hip strength. Right?
So hang in there. Don't start feeling better symptomatically and say I'm done.
Try a plan, right? Like people come in and they've like, oh, I've seen 8 different practitioners. And I'm like, what? Once you saw 8 people once, like maybe one of those guys could have helped
really
you
long
beforehand.
Appointment. Yeah. It was like an hour.
Maybe none of them would have known, but at least give it a try. Yeah.
And then same thing with the cupping. How long do they typically go before seeing advantages?
I mean, if we're doing it for the kind of superficial neuropathic type pain, we like to see that change in the visit, right? If you're doing it because you're challenging the microcirculatory system and you just want to see if that makes a difference for your chronic upper trap tightness.
Yes.
then I would say depending on the bruising and if the trust of your practitioner and all that, if they're ethical, I mean, it could take some time, right? But usually the way we use it, we're just, let's see if this thing works and then let's recheck it, which I think is a vastly superior way to get all manual therapy in the overwhelming majority of the cases, right?
And just practicing in general, it's nice to have some objective benchmark that you can keep referring to, like a lab test or, like you said, maneuvering that you can bounce yourself off of and say, okay, this is working. Let's do more of it. It's not, let's change course.
Otherwise, right.
You're a very scientific guy.
Yeah, you don't want to, I don't want you coming in because I tell you that it feels tight to me.
Right.
I want to empower you and be like, no, look, it's normal. You got a full toe touch, right? All these objective measures, just like you're talking about with lab work, are just key.
Yeah, you have to have some foundational something that you hold close where you can keep referring to it and see objectively, is this working or not?
100%.
And then I lately, in the last year or so, I've been seeing more and more gym goers walking around with all these, cupping marks on their backs. And so tell me about bruising. Is there any bruising that, other than those conditions that we talked about, that cupping and dry needling will cause?
I mean, anytime, I always joke because there's like some of those big tough guys, I'll warn them, look, if a needle touches a vessel, the vessel is going to break and you're going to get a bruise. Right? That's normal. And these big tough guys will be like, dude, I don't bruise.
My vessels don't bleed.
I don't bruise. I'm like, no, you will. You're going to. So, usually needle bruises, I always joke, like my clients will be like, is this from you? I'm like, if it's a perfect circle, it's from me, right? If it looks like not it from me, then it's probably from you bumping into something. But it's funny is those needles are so small, the overwhelming majority of the time, you don't bruise at all. Right. If somebody does bleed from a needle, it's overwhelmingly less than one drop. If they have it on their arm, it's not going to even, that drop won't even run down the arm. It'll just sit there and you take a cotton ball and boop, and it's over, right?
So you're not exsanguinating from one of these.
I do have I don't know if we have time, but a very funny story. I was needling this lady's leg. It was her hamstring. And I hit a spot, one drop of blood comes out, and I'm like, oh, we got a bleeder, right? And then right then I needed to bolster her leg up. I wanted to bend her knee. So my assistant was walking by and I go, Alex, grab me a towel.
Oh no.
She's like, oh no. Am I bleeding that much? I was like, no, you're not.
Should probably put some words in between you're bleeding and get me a towel.
That's been a good story for a couple of years now. But it's minimal. The bruises can last for sure, just depending on what you hit. But interestingly, I don't know if we want to be this graphic, but typically when you take a needle, you're looking for what we call a bony backdrop. So if you're needling the glute medius, you're all the way down to the iliac crest. Let's say you might be, which is one huge advantage to a needle, is you can actually reach with a needle where you can't touch with your hand. Right. Like it would take a silverback gorilla to get down to your hip bone. From your glute, right? So, and that's kind of a little bit how I found it. There's a really famous physical therapist that was talking about there's some places you just can't reach your hand. And I had made a living helping people with low back and knee pain by working on their hips. And I would leave every day whipped, like lower the table, dig my hands in, grab the muscle, lengthen out under tension, do that all day. And then I saw this little vlog, I guess, with a guy, and I was like, well, I'll try it and see if it helps some people. And it's just amazing the result you can get when you do treat the structure that you're aiming at. Wow. You also have incredible tactile sense with a needle, right? So that needle is so thin that, let's say you stick it in somebody's glute, or you can oftentimes find old tears. Like people will forget to tell me. I'll be needling an athlete's quad, and I'm like, oh, this needle is not cutting through like a hot knife through butter. There's a bunch of drag right there, and the needle has a hard time getting it or pulling out. And then you can maybe do a few visits where you put a small army of needles in that area. And then maybe after, let's say 6 or 8 visits, that needle will start to slide like a hot knife through butter again.
Really? So that's tonicity. That's not scarring.
Well, no, that would be scarring, right? That would be without a doubt, right? They're like, oh yeah, I mean, you can sometimes outline an old tear with a needle by sticking. Like I had a lady a couple of years ago that came in who had a calf tear. They opted not to do surgery. and she had been 18 months of physical therapy with a bunch of neuropathy still on her foot. She's got that posterior tibial nerve was getting compressed in her calf. Couldn't stand at work, couldn't ride a bicycle. And I was, one of the first visit, I started a needle her, and I found like exactly like a little racquetball sized, dense, fibrous needle, having a hard time going in, coming out. And her husband had driven her. I called him back to the office, and I was like, hey, check it out. I put one needle right in the middle of that scar and where the tear was, and then I put one needle, I don't know, a quarter inch away. And I had him pull the needles out to show him. And that one needle slid right out, and the other one he's tugging, and the skin's gripped onto it. And I'm like, just so you know, this is not a tone thing. This is a tissue, like a true, some scarring, fibrosis that's potentially compressing that nerve and causing this distal numbness, tingling, paresthesia, pain, right? So in a case like that, that's obviously going to require a lot more treatments than somebody that just is a simple strain, or they have a tendency to have tight traps.
Now, let me ask you this, Sam. If you didn't have that skill and you weren't using the needles with your other, modes of diagnostic maneuver, would you have been able to find that on exam?
No. I mean, you can only palpate so deep, right? So, and the deeper you press, the less sensitive you are. So tactile sense. So if you're in somebody's hip, for instance, 3 inches in, you're not going to feel.
So it seems like a really critical piece that you've extended to your traditional training.
Can be absolutely critical. Oftentimes, if you get a good exam done and you stick with your treatment, I mean, there's plenty of people I helped for 7 years before holding a needle.
Right.
But there are times where there's for sure things that would just be missed.
Practically speaking, though, like that poor lady you were talking about went almost 2 years not being able to ride a bike, walk properly, the 18 months. And just be able to turn that around on, within a visit or two.
Yeah, well, I saw her several, but I did see her many, many times. But her calf, happy to report, is you cannot find the tear anymore.
Wow.
And she actually just came in, I think, 3 weeks ago, and she hasn't had any pain. She just now comes in. She's like, hey, I was hoping you'd just take a look. I'm like, you're good. She's doing boot camp. She's cycling. She's now retired. So she's working out and doing all the stuff.
That's amazing. That's a great story. And talking about training, going back to the fitness part of things, if you have someone that just had a cupping procedure or dry needling, do you tell them to, hey, hold off from going to the gym for an hour or something? Is there a time frame?
Absolutely not. No. I mean, if you're worried about they have some instability or you think they're going to endanger themselves or they got a disc and you don't want them to flex.
Right.
But no, I mean, the soreness from treatment, it oftentimes is helped by some movement. So oftentimes we'll encourage. And then let's say you take somebody that's had poor access to shoulder flexion and then you treat them and now they can flex their shoulder. Well, let's go ahead and use it so you're not renting it, right? We want you to now go out and do some strengthening, take it through its full range so that you're much more likely to hang on to your result than if you just say, let's go back to my computer job and then lay down on my side at night. So movement, and that's why in our office we have the gym, and why in a typical visit you get your soft tissue work and then you go out to my exercise rehab specialist who follows up with your home care right there, right? Wow. So we can try to avoid any snafus like that.
That explains all the cupping marks at the gym then. Yes. Got it. And then the other question I get is, will I get sore from either of these treatments?
Yeah, I wouldn't say from cupping. I mean, you might have some local tenderness hey doc, if I push on it, it's a little sore in my skin. Dry needling for sure, the first time can last, typically about a day.
Okay.
But depending on the severity, and then certain muscles are more sore, typically like calves are typically more sore than other areas. Right. But your health status, your hydration, how old you are, chronicity, all those things go into it. So through my experience now, I have a much better job of guessing at how sore I'm going to make somebody than as a young buck trying to, So I would say you can, without a doubt, expect some soreness the first few times for about a day. By your fourth or fifth visit, it hopefully would be more like an hour or two.
It's funny because you mentioned calves. We had a mutual patient that came in to see me the other day that I was palpating the calves as part of an exam. She's like, I just had dry needling done, so now I have a little more sympathy
there you go.
for...
Yeah.
But, and you mentioned teaching your patients cupping and doing it at home. Talk about the safety of doing that at home.
Yeah, I mean, I think just err on the side of caution, right? So we typically, at that point, we've developed a specific thing that we want them to do. We don't want to leave the cups on for too long, right? That's really the main danger to cupping, is just too long, nasty bruise, and you don't want to cup over a bruise. So if you're still purple in that spot, don't throw a cup back on it, move the cup over a little bit. But it's typically pretty stinking safe, and when I'm using it, I'm doing it more like, let's stick that cup on here, maybe we move it around, add some neck movement, and then it might be just a couple minutes at a time. Okay. So we're not even expecting a big fat bruise anyway. So it's the way that we use it, very safe to do at home.
Great. And if they're doing it on their back, let's say, in a hard to reach place, can you still do that yourself? Or
I mean, if you could reach it, there's little cups now that are, some are, suction, some are glass. We got to use alcohol and fire. That's the sex appeal, right? It makes no difference. I don't even find them to be as effective myself. But there's a pump one, and then there's some now that are really cool that are kind of like a silicone that you can take you can squish it to get the air out of it, and then you place it, and then it creates a vacuum, and then those are more moldable, so they can go over surface irregularities. Like if a scar is puckered down on your wrist, a little bony area where a traditional cup would have a 0 chance. Yeah. These little suckers will and they come in all different sizes from small to big, and you can get creative and,
And football's really big here in Texas. Tell us about how you use this, the dry cupping and needling for the football players. What type of care do they typically need?
A lot of my NFL guys, I'm doing a ton of needling on.
Okay.
Through the season, if you're a linebacker in the league, by week 10, you have a whole list of old orthopedic injuries. You've had your labrum done. You've had an ACL surgery. You've had a stinger in week 6. You sprained your elbow tackling some guy in week 8. So it's a lot of soft tissue work, and then the sheer size of the guys, the needles are so superior, right? They're already getting tons of manual. They all have their own massage therapist that comes to their house with a massage room set up. Right. There's not a shortage of massage and hands-on therapy. So I'm usually playing bad guy, doing longer sessions and looking at joint health and just sacrificing their soreness in the short term for their career in the long term.
Amazing. Well, Sam, thank you for everything that you do and helping me take care of my patients. And I'm definitely going to keep telling them more about cupping and needling and where to find it. And
man.
Tell me if someone's interested in this, what's the best way for them to reach out to you?
Probably you just Google my practice name, Next Level Chiropractic and Rehab. It's www.nextleveldr.com. Awesome. And then we have our info down on there.
Perfect.
That's probably
and we'll
the best.
Put everything in the description for everybody. And again, I just want to really thank Dr. Sam Sneed for coming in, and hopefully you get to come back in and talk more to us.
Love to. Thanks for having me.
And I'd like to thank Founding Media for hosting us. Thank you guys again for tuning in. We'll see you next time.